right. Hi, everyone. Thank you for joining us for this episode of the Shakopee Chamber Podcast. We are excited to be back and bringing you important content about Shakopee and the surrounding community. My name is Tim Zunker, and I'm the interim president for the Shakopee Chamber and Visitors Bureau. As many of you who are members or involved with the Chamber know, our former president, Angie Whitcomb, has moved on from the organization to work with the Minneapolis Regional Chamber of Commerce. This was an exciting opportunity for her, and we wish her all the best. It'll be really tough to fill her shoes, but I look forward to the opportunity. This podcast is something the Shakopee Chamber created in the midst of the COVID-19 pandemic to help pivot and get pertinent information out to the membership and the community in a new way. We look forward to continuing to bring you interesting guests who bring their expertise on a variety of topics which affect us all. If you are a frequent listener, you know a lot of the previous podcasts have been related in some way to the COVID-19 pandemic, and this one's no different. However, because of the hard work of this week's guest, COVID-19 being the hot topic of discussion may be over sooner than later. So at this time, I would like to introduce our guest, Adam Bakken, Pharmacy Manager with St. Francis Regional Medical Center. Adam, thank you for joining us today.
Thank you, Tim, for having me. Really excited to be on. Absolutely. This is certainly a pretty exciting time with COVID-19 definitely taking up the news and the air around everything else. Definitely been the focus for all of our healthcare workers around the nation and obviously locally in Shakopee. Pretty exciting time to now be able to fight back, and vaccine work has certainly been dominating our time. But really happy to be able to share any information that I have with you and the listeners.
Perfect. Thank you very much, Adam. First, let's start. Would you please tell us a little bit about yourself and your role as pharmacy manager at St. Francis?
Yeah, absolutely. I'm a pharmacist. Most folks, when they think of a pharmacist, they think of somebody behind the counter at Walgreens and CVS. I certainly have many colleagues who do that work, and that's fantastic work in serving our communities. Inpatient healthcare and pharmacists and pharmacy is a little different. So we are working hand in hand with our medical doctors, our nurses, our respiratory therapists, as well as our other support staff in caring for patients that are actively hospitalized. As pharmacy manager here at St. Francis, I lead a team of about 30, a mix of pharmacists and pharmacy technicians. And the range of duties is pretty broad. From distribution, we distribute accurately, safely about 250,000 doses per year to our hospitalized patients. That's kind of on the operational side. On the clinical side, our pharmacists are reviewing and heavily involved common therapy modification, working hand in hand again with our doctors and nurses, ensuring that people are being treated appropriately for their condition. Definitely challenging work in the middle of pandemic, but also very rewarding as well.
Well, great. Thank you, Adam. And thank you for your hard work with all of that. That is terrific. So let's talk a little bit about the COVID-19 vaccine. Would you be able to tell us a little bit about the Minnesota emergency management policies used to help distribute the vaccine fairly and equitably across the state? We've heard reports from some of our association partners that the vaccine is not getting to places fast enough, but maybe you can shed some light on what is actually happening and why.
No, absolutely. Certainly challenging. I think the reports and frustration of the rollout are certainly not are understood, and that as fast as we go, I can understand that people want it faster, and so I don't fault anybody for that feeling. Minnesota is really, I think, has an advantage in that we have a really robust emergency management system by region. I think we're one of the models for the country on how to distribute and effectively handle something like this. And really what has been shown is we've been able to distribute fairly equitably across the state, in that some areas of the country, you can see that the metro regions are really, really heavily focused on, and some of the outlying areas are not as far along. It's been almost the reverse a little bit for Minnesota, in that our outlying areas are actually farther along because we have put the infrastructure in place to allow them to have equal access. And just with the smaller sites, it's a little bit easier for those outlying areas to be a little bit more nimble, if you will. So we are doing pretty darn well in Minnesota, and we'll talk about it. I think we'll probably touch on it a little bit later, but we're at a pretty exciting point in the vaccine distribution that we should see some pretty quick movement in the next few weeks.
Wow, that's great to hear. Definitely. Thank you very much. So now let's talk a little bit about what happens when a facility receives the vaccine. What are some of the issues St. Francis or other facilities are running into for storage, especially considering one vaccine needs to be stored at a much colder temperature than the other? And what is St. Francis doing to overcome any obstacles to make sure storage is not an issue?
Yeah, absolutely. So a lot has been in the media. A lot has been talked about on what the requirements are with these mRNA vaccines. So the two currently approved in the U.S. are Moderna and Pfizer. Both are frozen, so that in itself lends some challenge. Not all clinics or pharmacies has a medical grade freezer. Even with Moderna. But then you move on to Pfizer, which due to the study and due to different requirements of the lipid nanoparticles, are actually require negative 70 degrees Celsius. So that's tough. And our hospitals can generally handle that. Anywhere that is providing a certain level of orthopedic surgeries probably has that technology already on campus. So hospitals can better handle the Pfizer product, and we've really seen that play out across the nation, across the state, on at least initial planning and distribution. Is the hospitals are really handling that Pfizer product, and then long-term care facilities are taking the Moderna. Going a little bit farther is just the distribution and the cold chain storage. This is something that healthcare entities do and are actually pretty darn good at. But that negative 70 Celsius does make us rethink a little bit. So what most healthcare groups are doing is they're kind of following a hub and spoke model, where they're receiving in large quantities of vaccine to a central area that we have very robust storage capabilities, that we can keep at negative 70. And have that 6-month expiration dating of the vaccine. So very good. And then on a weekly or daily basis, depending on the situation, that hub is then sending vaccine out to the spokes. And once you take it out of that ultra low, you've got about 5 days of dating that can be stored in the fridge. most places have a medical grade fridge or a storage solution for 2 to 8 Celsius, and really that is the model right now on how to spread that vaccine to all the sites.
Great. Thank you very much. You touched on mRNA, which is an interesting, not being in the medical field. So if you could hit on how do mRNA viruses work, and how do mRNA vaccines work to help stop those viruses?
Yeah, absolutely. So if we harken back to high school science with our DNA, the RNA vaccines or messenger RNA, that's actually RNA would be a result of our cells. When our cells need to make proteins, they have machinery to read DNA, and they'll make RNA. And that mRNA is actually instructions for cellular machines, essentially, to make proteins. So that's what the messenger RNA is. It's really just genetic instructions to our cells to make a protein. And the protein that it's asking to do is a particular spike protein that is on the outside of the virus. It's fairly robust. It doesn't mutate a lot. Also, that spike protein is what is required for this COVID-19 virus to get into our cells. So what we're doing is we're sending that instructions for our cells to just make that one component of the virus. It's then sending that protein to the outside of our own cells, and our immune system is saying, "Hey, that's not normal," and then we're building an immune response to it. So when we see it again, or if we see it again, which in this case would be for a natural infection of COVID-19, our body is ready for it.
Wow, that's great. Thank you for that information. It's really good stuff. To go back to a little bit on the vaccines, Pfizer, Moderna, maybe you want to touch a little bit on the outlook for the new vaccines that are coming to market.
Absolutely. Pfizer was first. Pfizer and BioNTech is their partner. They were first. Our Moderna was about 1 week behind. So very, very close. Both messenger RNA vaccines. They're very, very similar in a lot of ways. Pfizer's 21 days apart, Moderna's 28 days apart. But in all the, obviously we've already talked a little bit about the storage differences, but in all the ways where it counts as far as efficacy and side effect profile, safety, which is very, very safe, they're very similar. So that's really good things. You asked a little bit about new vaccines. What's the horizon? So we've got 2 in the market right now in the U.S. The UK has already approved AstraZeneca or Oxford. That's really exciting. That's likely coming very soon. J&J or Janssen, which is the vaccine arm of Johnson & Johnson. We're expecting some kind of submission soon. There's also Novavax. I'm sure I'm missing some of them, but we're likely, they're all actively conducting phase 3 studies and analysis. We should see that submission definitely 2021. And some of them are really exciting. They're different than the mRNA vaccines. Some of them are using a little bit more traditional technology, which has pros and cons. One of them is that the J&J vaccine is currently studying a step 1, like a one dose vaccine, which certainly has some logistical advantages when you're talking about vaccinating millions of people. but all of them, at least initially, look very promising.
Well, great to hear. I'm interested. I was intrigued by the 1-dose vaccine as a possibility coming to market. And you said 2021. Is that something where, they're going to go through clinical trials and different things like that? And that's something where it's going to be like Q4 2021 or, hopefully sooner?
Yeah. My crystal ball, I think, probably says sooner than that. I know all of these companies are doing really heroic work. The two vaccines on market can really be looked at as a medical miracle. It is absolutely impressive of what is done. And as I said, AstraZeneca has already been approved overseas. I expect that to be probably submitted soon. I don't have a time. J&J, Novavax, both I would say in the first half of the year, but that's a personal guess. That's not with any real founded information.
Great. Thanks, Adam. Recently, we have started hearing about mutations of the COVID-19 strain in the UK and South Africa, and that this mutation has been found in the United States. And I just read an article recently where it was found in the South Metro, Minneapolis-St. Paul Metro. What should we know, and what does this mean for us in vaccines?
Yeah, absolutely. So a lot, certainly a lot in the press right now around those mutations and new strains. The UK strain, there's one out of South Africa. The UK strain is the one definitely that impacts us locally. That, as you said, there were 6 confirmed cases very, very recently, as of this week or last week, that were identified. I guess kind of what I would say is that there have been hundreds of mutation strains of the COVID-19 virus around the world. And I think hundreds is probably a lower estimate of the number of mutations. But the UK strain specifically has already been studied. All the strains that we know of at this point, we are fairly confident that the vaccines in production are still effective against those strains. It is certainly concerning that we believe that the UK and South African may be more infectious, but we certainly shouldn't lose faith or shouldn't really affect our plans with the vaccines.
Great. That's good to hear. So we'll get into a little bit of interesting stuff on myths and things surrounding the COVID-19 vaccine. If anybody goes on social media, which sometimes is not the best idea, you see things like somebody posts something about someone passing out right after taking the vaccine, to where if you get to the really extreme, people are saying that the vaccines have micro 5G chips and tracking chips in them. Help us debunk these myths and talk about the safety of the vaccine.
Sure. I think the safety piece is really, really important. And a lot has been done to say, I don't, how can I trust these vaccines? They've been produced so quickly. How can that have been done safely? So I'll try to direct there first. Is that mRNA vaccines have a couple things that are going for them. One is the technology is not new. They've been studying mRNA vaccines for over a decade, and it has stalled at different points, primarily due to funding. And in this situation, that really wasn't a barrier. And that is really kind of showing what the medical community and the science community can do when you pull away all those barriers. They did the phase 1 studies to show efficacy, to find that right dose. And then the phase 2 studies that are in development that are generally done for any medication, any vaccine, that's primarily done for risk mitigation of the company. Is that it's generally done to say, am I going to lose my shirt on if I go to the next phase? And kudos to the governments that basically went to the vaccine manufacturers and said, we will pre-order our doses, whether it works or not, you'll get paid. So because of that, the vaccine manufacturers and the R&D were able to do everything in parallel instead of in series and waiting for the logistical approval and the finance approval. And they were able to go so much quicker, but yet do all the same steps they normally would do because all those barriers were removed. So and the safety and the efficacy data on these studies is pretty fantastic. Specifically, this is probably the most scrutinized studies that have probably ever been released. So I feel very confident in the safety.
That's great. Oh, go ahead.
Targeting a little bit on some of those myths. They're tough, because I don't know how best to reach those, but I'll try to do a few. So I don't want this vaccine to modify my DNA. It doesn't. It is a messenger RNA. So, and it's challenging to be able to speak to the science, but RNA doesn't go into the nucleus of the cell. It does not interact with your DNA in any way. Your DNA is housed in that nucleus. All the RNA is doing is going to our ribosomes, our machinery that makes a spike protein. And then after that's done, our cells sweep up that extra mRNA and it's gone. So will it modify my DNA? No, it will not. Pregnancy and fertility, that's one definitely hits home to a lot of individuals. Try to discuss some of the origin of that myth. In that some folks have said, well, this protein, the spike protein, looks really close to a protein in the placenta. That was the origin. It's not. It's not even close to that protein. And furthermore, if we use that logic, we would have seen decrease in fertility and pregnancy from wild type infection. And I can tell you, hospitals are saying is that we are a lot of babies are getting born. So that's really not founded either. The microchip one, I don't necessarily know if I'm going to be able to convince anybody that does believe that, but I can say that the mRNA vaccines are remarkably clean of ingredients. I look at the list; they've widely published what is in it, and it's pretty amazing. There's a lot of these people that are concerned about vaccine with heavy metals and other components that have really been removed from all vaccines for many years. So that concern shouldn't be there anyway. But beyond that, the active ingredients of the Pfizer vaccine are mRNA, lipids, and then some salts. So like potassium chloride, sodium chloride, and a buffer. So like there's just not a lot to them that I think folks should be pretty confident in that really tiny dose of what is being injected in the arm, just 0.3 mils. If you, one of my colleagues kind of told me is that if you eat potato chips, you're probably ingesting far more of non-natural items than a 0.3 mil injection into the arm.
I like that potato chip analogy to it. That kind of hits home for a lot of us, definitely. So it's good. Thank you for that information. That's wonderful. Lastly, where should people go to learn more about the COVID-19 vaccine distribution and when they may be eligible to get it?
Yeah, absolutely. So first and foremost, I would really, really encourage people to go to trusted sources. There's a lot flying out there on social media, on other platforms. Please go to a trusted source. Our CDC has a fantastic FAQ page. The Minnesota Department of Health has a great page. They put up a new COVID-19 vaccine dashboard to kind of understand where we are in the state. Mayo Clinic has a great FAQ page, and of course, Allina Health as well. Great FAQ page. So please look for a validated source to get your information from. Now, as far as when do I get the vaccine, right? That's kind of the $1 million question. This last week, the federal government probably indicated that they want to expand very rapidly to more folks. And that's good. Obviously, the supply of the vaccine is the rate limiting factor here. So prior to this last week, the government, the federal government, and the states were really kind of in step with, okay, phase 1A, we're gonna vaccinate our healthcare workers and our long-term care residents. Phase 1B, we're going to vaccinate 75 years and older and our essential workers. I know there's a lot of discussion around let's get this to teachers. Our kids are going back to school. And then phase 1C, 65 to 74, and anybody with a kind of underlying condition. That got a little fuzzier this last week, and Governor Walz really said, no, as of right now, if you have vaccine, you can start to distribute your vaccine to those who are 65 and older and an underlying condition. Every healthcare system in the state is really leaning into this. Our large pharmacy organizations are really leaning into this. I would say that your healthcare group was probably going to be reaching out to you if you qualify within the next few weeks. Really, our goal is to be able to move effectively into the public by February 1st is really that timeline. But this is all dependent on, do we have the vaccine to do it? So the communication from the federal government, the communication from Governor Walz, definitely trying to get communication out there and is the right message. And trust that your healthcare systems are preparing and are ready. When the vaccine comes, we'll be ready to come be involved.
Perfect. Thank you. And we'll include the links that you had mentioned, CDC, the Minnesota Department of Health, including the dashboard, and then Allina Health in the post when we post the podcast. So thank you.
That's excellent. Yeah.
Adam, thank you so much for providing all of this important information, setting the record straight on certain topics floating around in regards to the vaccine. Also, thank you to our listeners and our members at the Shakopee Chamber and Visitors Bureau. Your partnership with us is greatly appreciated. Everyone, stay safe, stay well, and we'll see you next time.